This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about why you might have thumb-sided wrist pain when you pick up an object. If you like this video, we put out new content weekly, so please like and subscribe. So you might find you go to pick up a baby, maybe you're using a frying pan, or you're picking anything up off the floor and you have a lot of pain like right here. So what is it? It's by and large is something called quervain tenosynovitis, which is really just tendonitis of the first extensor compartment of the wrist. All you really need to know is that there's a couple tendons that go through the wrist, up to the base of your thumb, and those become really inflamed through a tendon sheath. That will cause a lot of pain when you do any of this sort of movement, and the test we do is actually something called the Finkelstein's test, where you take your thumb inside your fist, you hold your hand like this, and you push down, and if they have a lot of pain here and it's tender to the touch, that's pretty much diagnostic. X-rays really aren't going to show much. MRI might show some inflammation, but you really don't need that. So what do you do about it? So there's certain stretches you can do where you kind of stretch that tendon out so it glides better, and the same kind of movements that cause pain are the same similar sort of stretches you do, but if you do stretch them, you want to make sure you're not experiencing a lot of pain while you do it. A little bit of stretch is okay, pain isn't. So that's one of the things that we do. Other thing you can do is wear a wrist splint that covers up the thumb. It's called a thumb spica splint when you do have that wrist pain, or when you're doing an activity that requires those movements. That'll help. And the third thing is sometimes we'll do a steroid injection into that tendon sheath, and that can actually be curative in a lot of cases. So that's another option. So the options are stretch it, wear a splint when you do activities. Remember, thumb spica splint, or 3 steroid injection. Sometimes we'll do all 3 of those at the same time. Rarely they'll require surgery where you actually cut that tendon sheath, but by and large, most of them get better on their own. So I hope I was able to answer your questions about why your wrist might hurt when you go to pick up an object on the thumb side. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond, but I can't give you specific medical advice about your condition. Again, if you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.